Good morning, doctors. Today, me and my friends from Small Group Discussion B2 will explain our student project that entitled The Renal Corpuscle and Filtration Structure of Kidney. But before that, I will introduce the members of Small Group Discussion B2. So here is the list of our members. There are Dama, Amanda, Adelia, Louis, Cynthia, Angie, Ayu, Angeline, Eka, Angelia, myself, Natasha, and Bayu. And now we're going to present our student project.
So now let me explain the background information of our student project. So first, humans have a pair of kidney in the body, which is located at the back of stomach or abdomen, around thoracic 12 until lumbar 3 vertebrae. The shape is resembled to a bean, which has a red color that shows that kidney have a lot of blood capillaries. The concave side is facing to the medial. And also, kidney have an important part called nephron, which consists of multi body, proximal tubule, distal tubule, collective tubule, which this part is used for urine formation process. There are three processes which are very important. First is filtration in the glomerulus, reabsorption in the proximal tubule, and also augmentation in the distal tubule. By this background information, these are the problems that we formulate for this student project. These are the objectives, and these are the benefits.
The first one, I will explain about the anatomy of the kidneys. The kidneys are a pair organ that lie retroperitoneally on the posterior abdominal wall at the extent of T12 to L3 vertebrae. The left kidney is slightly higher than the right kidney because the presence of the liver on the superior of the right kidney. The kidneys lie usually 10 to 12 centimeters, width from 5 to 7 centimeters, and thickness varies from 3 to 5 centimeters. Its kidney has two surfaces, two margins, and two poles. The shape of the kidneys looks like a bean. The lateral margin of the kidneys is convex while the medial is concave. The relation of the kidneys to the surrounding organs are as follows. The superior of each kidney is the suprarenal glands or adrenal glands. The right kidney is adjacent to the second part of the duodenum on the medial aspect. The tail of the pancreas lies medial to the left renal hilum. The left upper pole is located adjacent to the spleen and connected by the splenorenal ligaments. On the anterior of the kidneys, there is the colon, while the posterior, there is the diaphragm. At the medial margin of every kidney, there is the renal hilum where the renal artery enters, and the renal pelvis and vein leave the renal sinus. The renal vein is anterior to the renal artery and to the renal pelvis. The renal pelvis is continuation of the ureter and precisely located superior to the end of the ureter and flattened. The renal pelvis receives 2 or 3 major calyces that each divided into 2 or 3 minor calyces. A lobe is comprised by a pyramid and its cortical tissue. The kidneys are divided into 5 segments, namely superior, anterior, inferior, and posterior. Each segment has its own vascularization. The kidneys also divided into 2 regions, medulla and cortex. Pyramids are formed by collecting tubules in the medulla and oriented with the base towards the cortex and epicets towards the hilum.
So in this case, I will describe the structure of renal corpuscle. The renal corpuscles appear aligned along the intrarenal arteries, while the renal tubules occupy the space between the arteries. Abundant hemopoietic tissue normally surrounds the renal corpuscles. The renal corpuscles are globular and small with a diameter slightly larger than that of the proximal tubules. And then the parietal layer of Bowman's capsule is composed of 3 different cell types. There's squamous epithelial cells with a prominent basal surface and a nebulated pattern of grooves and ridges. Other cells are columnar or rounded and protrude into the urinary space. The index connects the renal corpuscle with the proximal tubule and consists of 2 parts, proximal and distal. The proximal part appears as a long funnel-shaped tube composed of squamous or slightly rounded cells. The distal part is much shorter, is continuous with the proximal tubule, and is formed by multiciliary cells.
We're going to talk about the histology of nephron as an overview. In this part, histology of nephron composed of renal corpuscle, it is glomerulus and Bowman's capsule, and tubular system. In this session, we're going to talk about the tubular system, and the renal corpuscle will be discussed later. The first tubular system, it is proximal convoluted tubule. It has simple cuboidal epithelium, has broad border of microvilli, and abundant thin and long mitochondria at the basal pole of the cell. The next one is loop of Henle. Loop of Henle consists of 2 parts: is thin descending limb and thick ascending limb. The thin descending limb narrow in size and has smaller cells. It consists of simple squamous epithelium. The thick ascending limb is consists of simple squamous epithelium also. but it's thicker and has many microvilli and mitochondria. Next one is distal completal tube, or DCT. The simple cuboidal has larger lumen than proximal, has the most mitochondria, and has macula densa cell at the juxtaglomerular apparatus. The last one is connecting tubule and collecting duct. The connecting tubule has two types of cells, intercollecting cell and connecting tubule cell, or CMT. Has less mitochondria and DCT. The connecting tubule then get together, forming an arcade into collecting duct from the juxtaglomerular apparatus, and connecting tubule and collecting duct also contain simple cuboidal epithelium also.
Renal corpuscle is a component that contained in the nephron of kidneys that performs blood filtration functions. Every renal corpuscle consists of capillary called glomerulus and surrounded by a double-layer epithelium called Bowman capsule. Not only that, renal corpuscle also consists several histological components such as mesangial cells, podocytes, juxtaglomerular apparatus, and the glomerular basement membrane. This slide is about glomerulus capillaris. Glomerulus capillaris form a wide surface for renal filtration as well as delivering blood. The capillaris is the fenestrated type of capillaris with many pores on it. This capillaris functions is to do the blood filtration process in the urine forming process. The regulation of the blood occurs between two arterioles, aberrant arteriole and aberrant arteriole in the vascular pole. Aberrant arteriole bring blood to the glomerulus, and aberrant arteriole bring blood leaving the glomerulus. This slide is about Bowman capsule. Bowman capsule is one of the parts in renal corpuscle superficial to the glomerulus capillaris that furthermore to the urinary pole form the proximal tubule. Bowman capsule consists of two layers. There are visceral layer and parietal layer. The visceral layer is formed by podocytes that cover the glomerulus capillaris. These cells have long interdigitating cellular process and play an important role in blood filtration. The interstitial tissues that surrounding the glomerular capillaris contain cells called interglomerular mesangial cells. In the other hand, the parietal is spherical-shaped hollow structure formed by simple squamous epithelium. There is a space between visceral layer and parietal layer called Bowman space or Bowman cavity. This slide is about podocyte. Podocyte, also called visceral epithelial cell, is a differentiated epithelial cells that form the Bowman capsule, especially the visceral layer. Podocytes have complex structure. There are several primary processes that branch into many secondary processes that called pedicles. These pedicles cover the glomerular capillaries and interdigate by arising from other primary processes. Pedicles are coated with podocalyxin. Podocalyxin is a protein that maintains pedicle shape. Between pedicles that are close together, there is a space called filtration slit.
So next, let me explain about the mesangial cell. It is located beneath the basement membrane in the intracellular space or opposite from the podocyte. It has a small, irregular shape, heterochromatic and intended nuclei where it has a little bit of cytoplasm. The main function is for physical structure support from the glomerular capillaries. Other than that, it also has a phagocyte and contractile function. So next is juxtaglomerular apparatus, which is located in the vascular pole. It has three main components. First is macula densa, which is located in distal tubule and has a gap junction for communication. Other than that, it's also for monitoring the volume of fluid and its osmolarity. Second is juxtaglomerular apparatus, which is located in the wall of tunica media of afferent arteriole and has a function to synthesize and secretion of renin. Last, there is Lackey cell, which is located between afferent and afferent in a vascular pole. Well, there is no actually the main function of this component, but it known that it can be communicate with the intraglomerular.
Okay, now we're going to talk about the physiology of renal corpuscle and renal tubules. There are three steps of urine formation. Number 1 is filtration, number 2 is reabsorption, number 3 is recursion. These three steps will be explained by my friends later. In primary urine, there are various kinds of substances, include glucose, salt, sodium, potassium, and amino acids. Primary urine also contains electrolytes and crystalloids. Electrolytes in primary urines, there are chlorine and bicarbonate. The level of anions and the primary urine are 5% higher than the level of anions in the blood.
Okay, now we are going to talk about the filtration in renal corpuscle. Filtration occurs when the blood pressure starts pushing fluid from the glomerulus into the Bowman capsule. Renal corpuscle has a filtration barrier. There are capillary endothelium, basement membrane, and podocyte. This filtration barrier is to filter up fluid from the glomerulus into the Bowman capsule. Next, we are talking about the GFR or glomerular filtration rate. In normal adult, the GFR is 125 milliliters per minute. Systematically, the GFR can be formulated as follows. GFR is Kf multiplied by net filtration pressure. Okay, from the illustration can be seen there are some factors that affect the net filtration pressure and indirectly will also affect the GFR. There are glomerular hydrostatic pressure and Bowman capsule osmotic pressure that will increase the filtration rate, and glomerular colloid osmotic pressure and Bowman capsule hydrostatic pressure that will decrease the filtration rate. So that the GFR can also be calculated as follows. GFR is Kf multiplied by Pg, min Pb, min Pg, and plus Vb.
So the first one is the reabsorption in the proximal tubule. So proximal tubule has a large amount of mitochondria that supports the active transport. Proximal tubule also has an extensive brush to make the surface wider, so the transport of the substances is faster. There's also a counter-transport mechanism that reabsorbs the natrium and secreting mostly hydrogen ions. That is important to remove the bicarbonate from the tubule. Okay, next is the thin segment of Henle's loop. So thin segment of Henle's loop is highly permeable to water and less permeable to other substances. So about 20% of water that is filtered in glomerulus are reabsorbed in thin segment of Henle's loop. And then we move to the thick segment of Henle's loop. Thick segment of Henle's loop is more permeable to other substances than to the water. So about 25% of natrium, chloride, and potassium are reabsorbed in here. Okay, then we move to early distal tubule. Early distal tubule has a similarities like the thick segment of Henle's loop. It has co-transport natrium chloride that transfer natrium from the lumen to the cell, and there's a natrium kalium ATPase that transport natrium from the basolateral membrane to the interstitial cell. Okay, then there's also chloride that passively diffuse using chloride channels. And then we move to the late distal tubule. Late distal tubule has two types of cell. There is principal cell and intercalated cell. Principal cell has a natrium kalium ATPase that is the main role in the transport, and the intercalated cells, it has a hydrogen kalium ATPase that has a big role for balancing the acid-base level. Okay, so next up is secretion. Secretion is different than the reabsorption. It transfers the substances into the tubule from the extracellular fluid, and secretion depends on the transport system. So different segment of tubule has different types of channel or pump, leading to different types of secreted substances. So for example, in proximal tubule, it secretes a hydrogen ion and bicarbonate ion. And in the Henle's loop, reabsorption takes place as the major activity, but there's a hydrogen ion that's secreted into the tubule. In distal tubule, especially in early distal tubule, natrium kalium ATPase pumps are involved in the secretion of potassium. And in a late distal tubule, hydrogen kalium ATPase works for maintaining the acid-base level by secreting either hydrogen or bicarbonate ion when acidosis or alkalosis, depends on what the body needs.
Now, I will explain about the other functions of the nephron. The first one, the importance of hydrogen ion in acid-base balance. H secretion is important in neutralizing acid-base balance in our body.
H plus secreted into tubular are eliminated with the urine. The proximal, distal, and collecting tubule can secrete H plus ion based on the acidity of the body. If the body is too acidic, H plus secretion is increased, vice versa. The second one, potassium ion secretion, is controlled by aldosterone. K plus is the most plentiful patients in our body, but about 98% of the K plus are in intracellular fluid because the Na plus K plus pump actively transport the K plus into the cell. When the concentration of the K plus in our body decreases, the secretion in the distal is reduced to minimum, so a little amount of the K plus that is filtered and reabsorbed is excreted into the urine. When the concentration is increased, K plus is adjusted so the concentration in our body back to normal. So the secretion of the K plus determines the most of the concentration of K plus in plasma.
Kidney disease is one of the leading causes of death and disability in many countries around the world. There's two main categories in served kidney disease. First is acute kidney injury or AKE, and second is chronic kidney disease or CKD. The cause of AKE can be divided into three main categories. One of them is intrarenal AKE or AKE, that resulting from abnormalities within the kidney itself, including those that affect the blood vessel, glomeruli, and tubulus. Next. This infection is caused during the formation of antibodies against the streptococcal antigens. Antigens and antibodies react with each other and form insoluble immune complexes and then captured by the glomeruli, especially in the basal glomeruli. Once the immune complexes is buried in the glomeruli, many glomerular cells proliferate, especially mesenchymal cells, which are located between the endothelium and epithelium. Not only immune complexes, a number of white blood cells also trapped in the glomeruli. As a result, many glomeruli are clogged into this inflammatory reaction, and the parts that are not clogged usually become very permeable, where this condition allows protein and red blood cells to leak from the glomerular capillary blood and enter the glomerular filtrate. Next, the acute phase of acute inflammation usually subsides in about 2 weeks. And in many patients, kidney function usually returns to almost normal within a few weeks or months. But you have to know that because many glomeruli are damaged and cannot be repaired, so that there is a progressive deterioration of kidney function continuously for an indefinite period of time and lead to chronic renal failure.
Glomerular disease is one of the major clinical problems of nephrology. Glomeruli could be injured by several factors and in the course of several systemic diseases. One of the most common forms of primary glomerular disease is membranous nephropathy. It's characterized by subepithelial immunoglobulin containing deposits along the GBM. 80% of the cases are primarily caused by autoantibodies against podocytes by lymphocytes are suspected but remain unproven. The common cases appears as nephrotic syndrome. Some people have lesser degrees of proteinuria. The proteinuria is non-selective and usually fails to respond of corticosteroid therapy. Secondary causes of antigens including infections, malignant neoplasms, autoimmune diseases, exposures to inorganic salts, and drugs. The higher intake of nutritious food and a healthier lifestyle could reduce the risk of developing chronic kidney diseases.
Okay, next, this is the conclusion of our student project. So it can be concluded, the kidneys are an excretory organ that has shape like red beans, and humans have a pair of kidneys, lie retroperitoneally on the posterior abdominal wall on the left and right of the vertebral column. In the kidneys, there are nephrons, which are functional units. In the nephrons, there are three basic processes, namely filtration in the renal corpuscle, reabsorption, and secretion in the renal tubules. The kidneys can also damage and cause diseases if we do the wrong or unhealthy lifestyle. The diseases like nephrotic syndrome, asymptomatic hematuria, acute kidney injury, chronic kidney diseases, and etc. Okay, and then the suggestion. As we all know, if our kidneys have many components which have a very large function for our body, and if the kidneys are damaged, it's very bad and dangerous for our bodies. So let's take good care of our kidneys from an early age and change our lifestyle to be more healthy. The student project is expected to educate the readers and provide an understanding of kidneys. And we hope our student project can fulfill our segment. Okay, for the last slide, this is the bibliography that we can include as the source of our student project. Okay, that's all our student project presentation. If there is a short take, please forgive. Thank you and good morning.